Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hi, everybody. Thanks for tuning in for Direct Connection. Later in the program, lots of sunny spring days coming up. We will have some help for allergy sufferers later in the program. First tonight, the alarming increase in cases of autism. Why is this happening, and what can be done to help affected families? Joining us tonight are Dr. Rebecca Landa, director of the Center for Autism at the Kennedy Krieger Institute, and Michelle Landrum, outreach coordinator for the Johns Hopkins School of Public Health. Thanks to both of you for being with us.
Thank you. You're welcome.
Michelle, let's start with how you got interested in this, and that has to do with your youngest of two sons,
right,
who's how old now?
He's 6. My son Clark is 6, and I have an 8-year-old named Adam. So.
And Clark has some degree of autism
Right.
spectrum disorder.
Exactly. The autism spectrum ranges from, pretty severely affected children to children who can have Asperger's and who are fairly mildly affected. My son Clark is somewhere in the middle, and I thought I knew something about autism, but it wasn't until he was 4.5 when he was diagnosed. My preconceptions were that a child would be nonverbal or rocking or something like that, as some children with autism are. But Clark was very verbal and outgoing and to some extent, but he was showing some difficulties at preschool. And so when we had him assessed and they said he was on the autism spectrum, I was really surprised.
How's he doing now, a couple years later?
He's doing very well. He's in kindergarten, and he has a one-on-one aide at in a mainstream classroom. But we had a couple years of weekly behavioral therapy, and it's been a lot of work, and he's done very well. But,
great news.
Yeah.
Rebecca, more and more families have been getting bad news about this. So the incidence is increasing to nearly 1 in 100. What's going on?
It's 1 in 110. We don't really know why we have this rise. We certainly think that part of it is due to better diagnosis. And so, we're much better at diagnosing autism now than we were before, which is great in terms of giving proper treatment. But we are researching with funding from the National Institutes of Health, looking into causes about what could actually be causing autism.
And that brings us to the study that you're both here to talk about. It's called EARLY. What does that stand for? Of course, it's an acronym. It's always an acronym.
Do you remember what it stands for?
It's the Early Autism Risk Longitudinal Investigation. So when we talk about early, it's actually spelled E-A-R-L-I. So.
And what do you hope to find out? Who do you want to get involved in this?
Well, we're hoping that moms who already have a child who's diagnosed with an autism spectrum disorder will participate in this, because autism is heritable, meaning that if you have a child with autism, you have a much greater likelihood of having another child with autism or a set of milder problems than the general population. So
what's the number like? So if it's 1 in 110 overall for siblings, where is it?
Well, we're trying to figure that number out, but it's somewhere between 4 and 20%. Okay,
so if these people get involved in the study, what do you hope to learn as early as pregnancy, right?
Right. Right. We want to find these women preferably before they're even pregnant, if they're thinking about having another baby. We certainly need to find them before they're 20 weeks pregnant. And what we're going to do is follow them and take biological samples, blood, hair. We're going to take environmental samples from their homes, dust. We're going to ask them a battery of questions about their occupational histories, what sort of products they use on their bodies, what sort of products they use in the house. And then we'll take some samples from the birth of the baby, some biosamples from the baby, and then starting at 6 months, these babies will be clinically assessed. until age 3. And so if any developmental delays crop up, the family will have the opportunity to seek early intervention.
What does it mean? Can I infer from that you think that there's some environmental aspect, or at least an environmental trigger in many cases?
Well, we know that genetics plays a major role in autism, but we also believe that there's a gene-environment interaction, so that you could have a genetic risk for autism, but then through some exposure during pregnancy, it could tip the scales over to the baby having autism as opposed to not having autism.
A couple of quick questions about incidence, and then I'll get to the phone calls.
Sure.
Way more boys than girls.
Right. And we don't know why.
And I also saw a report that can't remember if Hispanics were less likely, Hispanic children less likely, even accounting for any socioeconomic differences. Any rationale, or are there any other clues like that we've picked up along the way?
No. Every other epidemiologic study that's been done in Japan or the UK or other countries have not reported a lower prevalence of autism than other places, so no.
Let's take some phone calls. Jeff in Talbot County. Jeff, thank you for calling. Go ahead.
Yes, my name's Jeff. I have a son who was born 3 months premature, who his mother was diabetic and was finally diagnosed with Asperger's probably when he was about 17. And I'm just curious if any of those contributing factors may have led to his Asperger's, and what resources are now available.
Okay, now Jeff, did you say that his mother had Asperger's syndrome?
No,
mother
his mother was
diabetes.
Diabetes, right. I'm with you now.
Diabetic,
yes.
And he was born 3 months premature, 2.2 pounds.
Right.
Okay,
so,
thanks for the call.
Yeah, we do know that preterm babies are at increased risk for various kinds of developmental challenges, including autism. And maternal diabetes is also a risk factor, not just for autism, but for a variety of things.
So you were very interested in picking up these cases as early as possible. What's the advantage?
Well, the advantage of the pregnancy study, of course, is to look at gene-environment interactions. But then for the testing that comes afterward, as Michelle said, we can find developmental challenges in the babies very early in their development. The earlier we find those and the earlier that we provide treatment, the better the outcome for the children.
Give me a success story. So, somebody where you had better than expected results. Maybe your all-time favorite case of somebody who wasn't terribly functional and improved.
I have so many of them. I can't give you one. I mean, we run, I have 2 early intervention studies at Kennedy Krieger. One is for 1-year-olds with social and communication delays. Many of those children have an autism spectrum disorder. And then another one for 2-year-olds. And we bring them in, we train the parents how to bring out the best in their children, and we really go to town on the core problems these kids have. And I'm telling you, a lot of these kids make enormous gains.
What's the therapy like?
Well, first of all, a lot of young children with autism, they don't know how to play with toys, they don't know how to talk, they don't know how to interact socially. And so we basically teach them through play-based interactions. It's playing with toys, but doing it in a way that we teach them how to imitate, how to look at what's important, what the names of objects are, and how to take turns with peers, all that sort of thing.
It's very important. And I think parent involvement is really essential, because you can do a certain amount in a clinic setting, but at the end of the day, that child's going home, and that parent needs to know how to guide that child at home.
Right.
So,
role for medications?
Well, medications are not available to cure autism, but there are medications for things like anxiety, attention deficit disorder, obsessive compulsive characteristics. So, no, we don't have a medical cure for autism right now.
Where do you come down in this debate over whether there's a potential link to vaccines? Because you hear anecdotally so many cases of parents saying, my child was perfectly normal interactive, had the vaccine, suddenly clammed up and never came back?
So, I'm really glad you asked that question, because we have been doing this study of baby siblings of children with autism since 1997. So now we have hundreds of babies who are now, some of them 10 years old. And what we found by testing the babies about every 6 months since infancy is that about half the babies have the course that you're describing, and it's not related to vaccines. So even babies who don't get vaccinated, between the first and second birthday, many of the babies have a drop-off in skills.
Do you think that something happens in the brain? I mean, is it a brain wiring thing? Is there a section of the brain that acts differently? I'm sure there have been functional MRIs or something. Is it a chemical? What do you think is going on biologically? It's
all of that. So the brain isn't wiring normally. And also there is a problem with the neurochemistry. So this is a multi-system problem.
Let's take another call. Carolyn in Baltimore City. Carolyn, thank you for calling. Go ahead.
Yes, thank you. My question is, I have a grandson. He has a history of ear infections and everything. They had to, in fact, operate him. He has 2 tubes in his ears. He wasn't able to speak. He's just beginning